So thanks everyone for coming. Welcome to this parallel session on changing behaviour to population level. As you will have heard in the plenary session, this is one of the themes in the school, one of the cross-cutting themes. We've got a couple of talks today we only have two projects in this theme, and both are at a fairly early stage, but we have two talks about those projects, and those giving the talks, the members of the project teams are very keen to get your input. So we look forward to hearing what you have to say. We don't have very much time, so I'm going to press on fairly quickly, and I'm going to ask Zoe Tumpakari to start with her talk. So over to you, Zoe.
Excellent, thank you, Martin. So let me just share my sorry, it's just, yep. Excellent. Okay, can you see it okay?
Yes.
Yes, okay, excellent. All right, thank you, Martin, for the introduction. I'm Zoe Tumpakari. I'm a lecturer in nutrition and behavior change at the University of Bristol. And today we'll talk to you about our project, the public's role in public health, understanding and negotiating public support for policies designed to improve population health. As Martin said, we're at a fairly early stage, and in Bristol we're leading work package 1, so we'll talk to you about that. So when it comes to implementation of population policies to improve public health, public support is a key factor that policymakers consider, as it is likely to improve the effectiveness of the policies, but also produce favorable attitudes towards those who implement them. There is emerging evidence that public support is stronger for less effective and less equitable public health policies, such as media campaigns or nutrition labels. There are lots of there are ways to classify different policies. One of these ways is the degree of agency, so the extent to which people will use their personal resources to benefit from a policy. Hopefully you saw the talk yesterday. There was a very interesting talk from Gina Adams and John Cogan about the concept of agency, and that it is a continuous concept. So we have low agency policies on one end, where people use little or no personal resources to benefit from a policy, all the way up to high agency policies, where people have to use their personal resources to benefit from a policy. For example, they have to be motivated to engage, or they have to process information that is provided to them. At the moment, public support tends to be higher for the high agency policies. Use of different frames, though, could increase public support for the more effective policies, which tend to lie on the lower agency side, sort of creating healthier environments, if you like. So some of these frames could be, for example, communicating the effectiveness of a policy that could increase public support. But also policies that perhaps try to change children's behavior. These also could increase public support. To date, we have limited knowledge on what diet and active travel policies are acceptable to whom and why. And also there is limited activity to engage the public and policymakers in this debate. The evidence that we mostly have is from cross-sectional studies, but there is limited activity to engage people in what they have to say about public support in relation to diet and active travel. So in particular, we seem to be lacking evidence about what features the public and policymakers support in relation to diet and active travel policies. and how support may vary between demographic groups based on age, gender, socioeconomic status, location, and so on. So the overarching aim of the entire project is to explore the development of an emerging framework to predict public acceptability for various policy options aimed at improving population health, and we are focusing on diet and active travel. So in Bristol, the work we're leading, we will conduct semi-structured interviews to understand acceptability of diet and active travel policies, both existing policies, but also policies that people are less familiar with, just because familiarity may also impact on the level of public support. And we're also interested in drivers of these acceptability sort of features that members of the public and policymakers will support or oppose in relation to these policies. Findings will feed into a series of discrete choice experiments that Sophie will talk to you about in a minute, and both these work packages will feed into developing an emerging framework of public acceptability to change population level behaviors. So the questions we're asking are, how does the public and policymakers structure their thinking when deciding on their support opposition for different diet and active travel policies? And the semi-structured interviews will allow us to explore some factors that we're interested in and we know from the literature that may be important. First of all, we're exploring a range of different diet and active travel policies. Policies that vary on the degree of agency from low to high, and I will show you the policies we're asking in a minute. We're also interested in exploring some beliefs like perceptions around effectiveness of these diet and active travel policies, but also how we could use communication of effectiveness to potentially increase public support. We're also interested in some core values, for example, policies that are fair to various groups. As I said, policies that aim to impact on children's behavior may be better supported. For example, alcohol tax in relation to reducing underage drinking is better supported. Financial considerations that people may have in relation to these diet and active travel policies, and also the degree of autonomy. So whether people feel that having more or less freedom of choice will influence their public support. We're also interested in how does acceptability vary between demographic groups. So we're interviewing a range of different people in terms of age, gender, location, socioeconomic status, and ethnicity. So these are the policies that we're sort of asking about. We have produced a visual aid that we will use in interviews. As I said, we have considered different policies based on the degree of agency, and you can see the continuum. And we have produced these policies in consultation with our wider advisory group and PPI members. So we have economic related policies that aim to provide to provide subsidies or increased taxation to influence spending and behavior. So we have the sugar tax or subsidies in relation to diet, congestion charging, tax breaks, and the cycle to work scheme in relation to active travel. We then move on to town and city planning policies that aim to change how our cities are planned, are built and arranged. Such as preventing new takeaways close to schools or building cycle lanes on busy roads. We have policies that are guiding choice that are stemming more from the sort of the nudge area, like removing sweets from supermarket checkouts, reducing portion sizes, introducing plain packaging to convenience foods, and also in relation to active travel, introducing maximum working hours to give more time for people to exercise, but also prepare food. And then we have policies that inform and educate on the sort of high agency side that provide information like front of pack nutrition labeling, but also the Change for Life campaign that sort of promotes a healthy lifestyle in terms of diet and exercise. So these are just some examples of policies, but we have considered a range of categories. So we're asking people about those. So as I said, we're doing semi-structured interviews with 20 members of the public recruited by a market research agency based on gender, age, ethnicity, location, and socioeconomic status. And then 20 interviews with policymakers recruited via existing networks and snowballing. And we will develop the interview topic guide about the policymakers based on the findings that we get from the interviews with members of the public. All of the interviews will be analyzed using thematic analysis, and we will also use framework analysis to explore variability in the public support in relation to different demographic groups that we have. So as we're at a fairly early stage and we plan to conduct interviews later on with policymakers, we would really like to benefit from your expertise and knowledge. We will ask policymakers, we will present the same policies, we will explore the similar topics, but it would be good to know, and if you have any thoughts and suggestions about what else could be asked of the policymakers that may be useful or important to this research. So any thoughts, suggestions, please put them in the chat. Obviously, happy to take any questions that you have, and thank you for your time.
Great, thanks, Zoe. So we're open for questions, and there is one straight away from Ruth Kipping in Bristol, I guess. She asks, do political views need to be included in the recruitment strategy for the public? Interesting question.
Yes, interesting question for sure. In terms of political views, we do sort of explore that a bit in the interviews in terms of public opinion and how much the government should, when potentially they're allowed to use it, to what extent, and can they make decision regardless of that, or when they're allowed to make decision regardless of that. So we are using it, and we are trying to explore it a bit in the interviews based on that, Ruth, and that's a very good point in terms of political views. Yes.
Can I just add to that and ask, what kind of stakeholders, policymakers, are you including? Do they include politicians?
That's sort of something that, so we're thinking people that have the ability to make decisions on improving health. So anybody who holds a position like that. We were more thinking about practitioners, but it would be something interesting to discuss in terms of what politicians have to add, and because they're the ones essentially sort of taking the decision in the end. So that would be, I think, something to consider for sure if we want to include some politicians in our interviews. Yes, thank you.
There's another question here from Deborah Umbafana. I may have pronounced your name wrong, sorry. Are you asking the policymakers about the political environment they have to operate in?
That is an interesting one. I think that is something, a good suggestion that we potentially can consider, sort of including more of this political aspect in our interviews with policymakers, or actually asking politicians. I think that's a very good suggestion. That it's basically what the input I was asking for. That is something to consider. We have not considered it yet, but yeah, that is a very good suggestion. Thank you.
Are there any other questions from the floor? Okay, there's one. There's a few just rolled in. Sorry, hold on. Scrolling. Caroline Somerville, hi Caroline, asks, how do you decide which policies within diet and physical activity to focus on?
Yes, that is a very good question. So basically, there are lots of policies. We tried, we could not include many just because we are only interviewing 20 people. So we wanted to get in-depth information, but basically we decided based on policies are promising in terms of effectiveness. Obviously, the degree of agency was another factor we considered, but also policies that people are less familiar with. And these are just some specific examples, but the categories that we have created have a sort of overarching characteristic about each one of them. So hopefully, participants can talk about the differences between the categories. But yeah, based on effectiveness, consultation with PPI members, advisory group, and these are just some specific examples that we included.
So Steve Cummins made an interesting point in the chat earlier on about agency, which is something that I responded to say this is something we're considering in another research project, which is funded by the Public Health Policy Research Unit, which is that an intervention that is low agency for the public might involve a lot of effort or agency among policymakers or implementers. So it kind of raises the question of, I'm kind of interested to know, you haven't done your interviews with stakeholders yet, is that right?
Yes, that's right.
Yeah. So, I mean, you may get rather differing views from the public and the stakeholders. How are you going to reconcile those in developing your framework?
Yes, I think that would be something that we definitely, we're interested to see what happens. I think that would be an interesting finding in itself, whether if the public say something and then the sort of policymakers say something completely different, it would make a complex framework. And I think both views need to be taken into account and sort of find a balance, because low agency sort of policies tend to be more effective, but this is not to say that we don't need to inform and educate people, so using high agency policies as well. So I think that would be an interesting finding in its own right, whether there are contradicting views, and sort of something that perhaps can be incorporated in the discrete choice experiments to allow for different scenarios and how eventually, and see the findings from those.
So Catherine Sharp asks, are you asking the public about their current health status and behaviours to see if that informs their views? And then there's another one, a follow-up question from Deborah asking about personal locus control.
Yes, so in terms of health status and behaviors, there is some evidence from cross-sectional studies that obviously, if you're engaged in a specific behavior, you may be more favorable about a specific policy. But because these are qualitative interviews and there are only 20 people, we did not want to add sort of more variability. And also sometimes in qualitative interviews, people are preoccupied if you ask them about their own behavior and they may say something different. So we're not doing that, although yes, you're right, there is some evidence to suggest that people may respond differently based on their behavior. Yes. They can act. So in terms of personal locus of control, we're not, in terms of the public, we're not communicating the sort of the degree of agency, if you like. We're not telling them that, these policies sort of act subconsciously in a way, if we're talking about nudge, for example. That is something that we're also considering how much to emphasize in the discussions with policymakers, because obviously they will have a better understanding of the degree of agency of these policies. But in terms of the public, we are just presenting some different policies that we know they vary in terms of how much participants can act on something, but we're not emphasizing this as much, just because it will add another sort of layer of complexity for them. We're trying to present lots of examples because even these policies are hard for them to understand a lot of the times. So we're presenting quite a few specific examples to help them. Okay,
fine. I don't know whether Mickey or Sophie want to comment on any of the questions at all.
Yes, thanks everyone for the lovely questions. I've been taking notes, and we'll definitely take this on board as we develop also the quantitative part that Sophie is just going to bit. And actually some of the things that you mentioned about political affiliation and locus of control and the personal health status, etc., incorporated in the quantitative work, and I think that's the next stage, which Sophie will tell you more about. We'll be able to explore these other questions in the second stage. Sophie, I'll pass it on.
Yeah, we'll come to Sophie's presentation in just a second. Just one final question, I think, for Zoe, which is, do you think, this is from Cleopatra Harry, do you think your research will reflect real behaviour choices? And what she's concerned about here is the impact of the pandemic, that this might affect people's choice behaviours, I think, or behavioural choices.
Yeah, I think that is a very good point in relation to the pandemic. People, we're doing interviews now with members of the public. Obviously, we're still in a pandemic. This may impact their sort of, you know, the themes and what people have to say. I think we're hopefully at the stage that we're sort of getting out and everything has opened a bit more. So I don't think it would be as biased as it would have been a few months back, but that is definitely something that we will discuss in our findings, the impact of the pandemic. But that is a very good point that needs to be considered in our discussion. Thank you.
So I'm going to assume, Sophie, am I correct in saying that you're going to mention the polls? Yeah, okay. So shall we go to Sophie now then?
Brilliant, thank you. Okay, so yeah, I'm Sophie and I work alongside Mickey at Durham University and Laura at Newcastle University, and we're overseeing the quantitative phase of this project. There are some polls that we're going to ask you to sort of engage with this morning. The first one is kind of asking about how familiar you are with discrete choice experiments, because we were aware that we weren't quite sure who we would have in the audience and the range of familiarity people may have with this kind of research design. So feel free to get involved this morning by answering the polls, but we would also really like to see your input in the chat as well, which has already started with Zoe's portion of the presentation. So we're going to be working with a discrete choice experiment, and we just thought it might be quite helpful to start this morning by kind of giving you an oversight of what this design entails. They're really good for answering research questions that actually aim to understand people's choices, and in particular, they can help to answer questions about people's hypothetical choices, and they've become a very popular design within health economics. Very good for sort of providing insight into people's preferences. They can help to quantify trade-offs between different characteristics, which I'll explain in a second. They're good for identifying like monetary and non-monetary valuations, and they can be also really helpful for forecasting demand of a service or good, if that's what you want to get from your discrete choice experiment. So they're usually implemented in surveys, and what we've done this morning is just taken an example from a paper that Laura has worked on, where the individuals were asked which of the following 3 programs to encourage people to quit smoking would you prefer? So the discrete choice experiment presents different programs to the respondents. So we've got program A, program B, and program C. And each of these programs have been described by what we refer to as attributes. So in the red column, you'll see that it's broken down by things like type of reward, total value of reward. And within those characteristics, they can be explained on different levels. So a type of reward might be a lottery ticket, it could be a cash incentive, or it could have been no reward. So the idea is that the respondent actually reads through these different programs and they select which of the 3 in this example they would have preferred. So to put that into our context, sorry, if you want to answer the poll about this as well, then there's a question asking how familiar you are with discrete choice experiments, just to get some Friday morning participation. So to put this into our context, we're going to use a discrete choice experiment to actually elicit the general public's preferences about the acceptability of dietary and active travel policies and interventions. We're going to run a series of discrete choice experiments, and we're going to do this by following the guidelines for DCE best practice. And within the literature, this is often described in 4 stages. So first and foremost, the identification of these attributes and levels, which is where we're at the moment. And we thought we would use this session this morning to actually consult with you some of our ideas and see what your thoughts and feelings are about our decisions so far, and see if you have any good ideas, more effective ways to answer our research questions. We're also at stage 2 thinking about our experimental design, and we're going to ensure that we use the most efficient design. I think one of the main things with discrete choice experiments is that they can become very complex. So the more attributes we put into the DCE and the more levels we have, the more complex they can become. But there's ways of kind of equally distributing questions amongst the respondents to make sure that it's efficient. Stage 3 is about our data collection, and then finally the analysis and interpretation of our results. And we're going to ensure that we're using a nationally representative sample. So we're interested in responses from adults in England, and we're going to hope to get at least 1,500 participants per DCE. So we're working with large samples and really working hard to make sure that we're incorporating responses from hard to reach participants, so people from low income backgrounds, low education, and also unemployed. So this is where we would love your input. Okay. One of the research questions that we're aiming to answer is, how does time affect public acceptability of health-related behavioural policies? And in particular, to actually consider whether and how the acceptability of different policies may shift over time and how it impacts as a policy-making cycle. So as a research team, we've got together to grapple with this research question, and we have kind of come up with the idea that this would probably be best answered at the end of our discrete choice experiment, so kind of in a survey style. And actually asking the respondent, in your opinion, how difficult would it be for this intervention or policy to become popular with the public over time? So giving them sort of a sliding scale where they can indicate from very difficult, it would take a long time to become popular, to somewhere in the middle, moderately difficult, it will take some time to be popular, to all the way at the other end, it's not going to be difficult at all, and it's going to be popular from the start. So this is our idea as a research team, but actually there may be other ideas that you have about how to kind of tackle this issue of timeliness and public acceptability for interventions. So if you see there we have a poll question number 2, where we're sort of asking you as the audience, do you think that our idea of having it as a question at the end of the DCE is most effective, the best way to answer this research question? Or do you think that actually there's a better way to do this, and there's another way to do this? So you can agree with us or you can disagree with us. And if you do disagree with us, we would absolutely love to hear your ideas of how you think this could be better answered in the chat. Okay, I'll keep going. So if you have any comments to make, like, we would love to hear them, pop those in the chat, and I'll keep going so that you can type replies, and we'll come back to them at the end. So the second research question that we would love to hear your thoughts and opinions about is, what is the impact of highlighting commercial factors and the role of industry in the acceptability of health policies? So again, we've spoken as a research team, and we think that actually a really good way to answer this would be to include this idea of commercial factors and support from commercial actors as one of our attributes. So we've had a discussion as well about the different types of levels, and just to kind of explain this so it doesn't feel like too much of an abstract concept, we think that support from commercial actors could range in these different ways. So it could be voluntary. So an example of that may be the Change for Life marketing scheme, where commercial actors like Tesco and Asda voluntarily decided to display some of the Change for Life marketing on their shelves and on their products. It could be mandatory. So an example of this in the dietary world could be to do with the sugar levy tax, where actually supermarkets don't have a choice, they have to increase prices for sugary drinks. Or an example of where maybe it is voluntary for some and mandatory for others, if we think about school lunches, schools have it's mandatory for schools to provide a healthy lunch for students, but actually if the student was to bring in their own school dinner, whilst I'm sure schools have policies about these things to encourage healthy dinners, it is still a voluntary act for them to ensure that they bring in a healthy dinner. So kind of ranging from voluntary to mandatory for commercial actors. I suppose there's also a choice of that it's not important. So this is kind of how we've explored this idea of highlighting the role of industry and commercial factors within the acceptability of health policies. But we think that there may be other ways to do this as well. So, I mean, if anybody has any thoughts about maybe the levels that we've chosen, or if you can think of a different way to quantify this idea of the acceptability of commercial factors, and also if there's just a different way to approach this research question altogether, we would really love to hear your thoughts in chat function. And then the last thing that we wanted to share with you today was actually the advisory board have sort of advised us to think about the impact of COVID-19 and how the pandemic may have affected public acceptability of policies and interventions. So again, had a discussion as a team, and we think that the best way to do this would be to include it as a question at the end of a DCE or at the end of a choice set, to ask the individual, the COVID-19 pandemic has influenced how supportive I am of this policy or intervention. And again, giving them that option to use a sliding scale to indicate from strongly disagree to strongly agree how supportive, how much COVID has influenced their support for these particular policies. Or again, you may feel as though that this is not the best way to answer this question, and anybody sort of working on COVID research at the moment may have thought of potentially a more efficient or effective way to answer this research question. So we would really love to hear some of your thoughts. I think I can see there's been some things pop up in the chat, but at this point, these are our contact details. It may be that as a result of today, you have some thoughts about some of the issues that we're grappling with, and we would really love to hear from you. But we can also, at this point, ask if you have any questions for Zoe or us as to answer at this point in the presentation.
Okay, thank you, Sophie. Thanks very much. Let's go to questions. So there are a few things in the chat. I'm just scrolling through those. Hold on. So Deborah has questioned, asked you to clarify the question about this intervention on timeliness, but the slide showed 3 choices for smoking. Will it be clear for people they are commenting on one intervention?
Yeah, so sorry, I should have probably explained this a bit better. So we just used a DCE example from a previous DCE because we're actually at the stage now we're trying to design the attributes and levels that we're going to include. So that was kind of an illustrative example. But yeah, as part of the DCE, we will be presenting actual intervention choices to build our attributes and levels around. So they will know specifically the intervention that we're referring to.
Yeah. There's a nice idea from Liddy Goyder, who suggests that you might think about using Think Aloud interviews. So get people to do your survey and talk to them while they're doing it, so you can understand what they're understanding, how they're interpreting questions.
We've planned that into this initial stage of identifying what our attributes and levels should be.
Excellent.
Yeah.
Cool. And then Deborah asks, are you asking people about the fact they may like a policy, but is the environment and partner set up to make it an easier choice? I'm not quite sure I understand that question, absolutely.
So, sorry, I'm just also reading the question. Yes, potentially. I think Mickey might have some ideas about this one to do with the commercial factors.
You're muted, Mickey.
Yeah.
Sorry, my line is actually cutting off. So yes, actually about asking people about the fact that they. Yes, we will definitely explore. I also think whether the environment is set up to be conducive. So you might like or favor or support the policy, but as you say, Deborah, you're absolutely right. The timing, the context may not be right, or there might be commercial factors, etc. Depending on how this policy is implemented, and we will try and explore this as well within the DC. Thank you. Thanks, Deborah.
I just have one comment on your question on levels. I think you need to do a little bit of work on that. I'm not absolutely sure that they are very absolutely clear. I wonder whether you might want to look at some existing classifications of different types of interventions, from regulatory down to more voluntary. There are some of the, I mean, things like Nuffield ladder, which is probably not specific enough, but there are some other classifications as well. So I think it might help to have another look at that. I think we need to move on because we need to hear from Steve and have some questions on Steve's presentations. But I'd just like to thank you all very much from the Durham Bristol team for your presentations, and I hope the questions have been helpful. Let us move on. Steve, are you there? You're muted, Steve. Steve, you're muted. Okay, no, I can see you, but I can't hear you. Steve, you're muted. There should be a microphone icon at the bottom of your screen. Okay, is there someone technical who can help with this? Steve appears to be muted, but he says he's not. Someone from technical team at all? I don't seem to be able to unmute Steve. Hopefully Steve will be back with us in just a minute. Right, we have lost Steve altogether. I can't see him.
He says he's still here in chat box.
Yeah, but I can't see him and I can't hear him.
Yeah.
Can anyone see or hear Steve?
No.
No. Steve, I don't know if you can hear me, Steve, but if you click on the settings button at the bottom, you might be able to reset your video and audio. People are putting various things in the chat about buttons that I can't see, so that's not very helpful for me. No, Ruth, I'm not going to start singing. Sorry about this, folks. It's frustrating that we can't all just chat to each other, isn't it? Sarah Fothergill, I don't know if you can hear me, but is there anything you can do to resolve this situation? Okay, thanks, Sarah. Okay, thanks, Sarah. Okay, Steve has just called me on the phone to say he is in the session, he can see everyone, but it appears that no one can see or hear him. Sarah, I don't know if you have any other solutions to this problem. Yeah, Steve, we can see your chat.
Ah, that's it. Can you see me now?
Steve, welcome back. So pleased to see you.
Yeah, okay, well, I'll move on quickly, okay, because I don't think we have a lot of time. That's all right.
Can I just check, can someone from the audience please just message to say whether they can hear Steve and see his screen? Okay, everyone says it's all good. Off you go, Steve.
Yeah, also it seems to have gone into infinity as well. I don't know why. Hang on a sec. Can everyone see the full screen now?
Yes. Yeah, that's it.
Okay, I'll start.
Thanks, Steve.
So welcome everyone. Just a quick, just to say that also I've got a lot of feedback as well. Is anyone else unmuted? Okay, just to say that I don't have a lot of time, and I have some questions at the end. But if people want to contact me outside of the meeting, that's totally cool as well. Okay, so we have a 12-month project which is looking at the association between the use of digital food delivery services and household food purchasing. And this is being led by myself and kind of Cherry Law, who's also here today as well. We're based at the School of Hygiene and Tropical Medicine. And these are the rest of the individuals across SPHR who are involved. I won't go through the names, but I'm sure they'll be familiar to you. Okay, so just to start off with, the food retail system is quite an important part of the promotion of kind of diet and diet-related ill health. So we know that a large number of people in the adult population are overweight, and around 70% of children aged 2 to 15 are obese. And diet-related ill health, as we all know, is thought to account for around 12% of total mortality. So interactions with the food retail system are the main way in which the consumer obtains food. And I think some people now believe, well, I think agree that these interactions can be a key driver of population dietary health. So how we buy, purchase and consume food. In the past, it's fair to say that the power in the food retail system has traditionally been held by the major food retailers such as kind of Sainsbury's, Tesco and so on. And those organisations actually have driven innovation over time. For example, M&S are the first people to introduce kind of ready meals and so on. But the corporate practices of those organisations have also been one of the main drivers of what we buy and what we eat. However, this is kind of changing. These kind of traditional channels are changing. So at the moment, we're kind of going through this kind of fundamental transformation where there's a lot of digitalisation of the food retail system. So on-demand technology in particular is reshaping food distribution delivery, and it's making things like groceries and takeaway meals much more accessible and convenient. This isn't necessarily new. Actually, it's been around a long time, and kind of people forget about that. And Tesco and Iceland first introduced delivery through online means over 20 years ago. But the pace of change is really accelerating in the last few years because of a range of kind of technological reasons. And this is partly to do with the increasing ubiquity of mobile internet access and growing consumer acceptance and adoption of e-commerce. I mean, think about how ubiquitous Amazon is today, for example. We're really used to buying things online and using our credit cards. This is really created for kind of more technology-led organisations. I hesitate to call them food companies because I guess that's not what they are technically, such as Ocado, Deliveroo and Just Eat. And they've kind of entered the grocery market and takeaway food retail sector in the UK and kind of elsewhere. So this is just an example of kind of what the European food retail system looks like in terms of digital on-demand technology. There's loads of brands and some of them are recognisable to you Others won't be so because they're based in other kind of European countries, and they cross a whole range of kind of the chain, from on-demand food delivery through to delivery-only food plans, dark kitchens, even things like kitchen space rental and so on. So digitalization is not just about kind of food delivery, it's the whole kind of food chain. So it's been argued that these companies are kind of driving, these technology-led companies, sorry, I should say, are driving wider adoption of new delivery technologies by the existing traditional food retailers. So, for example, like Sainsbury's, Tesco, Asda are all investing in kind of their online offer. And it's also directly changing consumer food purchasing and consumption behaviour. But there's very little known about inequalities in the use of these kinds of services and how it affects what is bought and how often we buy it. And also the impact of this disruption at the moment is on inequalities in food purchasing and consumption behaviour and diet is also unknown, and there exists virtually no scientific literature in this area. There are a couple of papers that have been emerging over the last kind of year or two, but kind of no kind of serious engagement with this yet. And so what are the potential impacts, and why should we be worried about these kind of changes that are happening at the moment? Well, when we think about the takeaway sector, this can expand the number of restaurants consumers can access. It can reduce the effort of purchasing, making it easier for consumers to buy food, and also increase the purchase of high-fat, salt and sugar foods, including substitution away from home-prepared meals and or increasing the total purchases of these kinds of foods. In the grocery sector, there's a kind of slightly different set of issues, I think, occurring. It's likely that it will benefit more affluent households more quickly than less affluent households, simply because they're able to meet financially, that is, kind of minimum spend, pay delivery costs, and make cost savings through bulk purchasing. Thinking about your own grocery spend at home, you know, if you buy online, you tend to buy more and larger amounts. I mean, potentially, and I think, you know, we don't know the answer to this question yet. I mean, these households who buy grocery online are also potentially less influenced by in-store promotions and marketing, resulting in a healthier purchase basket. So I think we don't know the answer to that question. And also that lower income households have lower access potentially to online grocery, as they live in areas where distribution capacity is much less well developed or where there is less access to the internet. So the pandemic, I can't kind of leave this presentation without mentioning COVID-19, but the pandemic has also accelerated the use of digital food services and really increased retailer capacity in terms of its ability to deliver online purchases. And just a little bit here, you can really tell how much has changed just in the last 12 months. It's really accelerated online food sales. So according to the ONS, in December 2020, there was a 126% increase in digital grocery sales. And it's really nearly doubled the amount of all grocery retail that's sold through online. So it now accounts for 11% of all sales, up from 5.6% in 2019. And people might say that, oh, actually, this still isn't very much of the total amount of sales that are made online. But actually, this is really driven by capacity of retailers. Retailers themselves don't have the capacity to deliver much more than this at the moment. But as they increase their capacity, it's likely that people will transition more as well. I think it's fair to say there's also a natural ceiling in this area. There won't be, not everyone will buy things online, but it's interesting to see that it's accelerated so quickly. So there are fundamental changes happening at the moment in terms of people's purchase behavior. And when people think about online in terms of grocery, it's not just kind of food delivery, but it's also click and collect, and also new partnerships with fast food, traditionally fast food delivery companies like Deliveroo, you can see on the right here. So now you can buy same-day groceries in those 20 minutes from Co-op, Morrison's, Aldi, Sainsbury's, Waitrose, and so on. So there's kind of this hybridization of kind of the takeaway and kind of grocery retail sector as well. Just to give you give some interesting data we've just looked at. This is very preliminary data from 2019 about social class and the use of delivery services here. This table shows two columns, one for takeaway and one for kind of grocery. And it's very simple. You can see here that there is a linear relationship for digital takeaway with social class. So as you have a lower social class, your odds of using a digital takeaway service in the past 7 days almost doubles from AB. For digital grocery, however, there's no pattern of association, and that's adjusted for a range of kind of basic confounders. And similarly with BMI, so a measure of obesity and kind of digital use, we can see that people who use digital takeaway for out of home tend to be kind of have higher BMI than those who don't. Obviously, this is kind of a cross-sectional association, so you can't know whether this is truly causal, but it's very interesting that it's a potentially dose-response relationship, would just give us some indication that it might be some kind of true effect, but we'll look at that a bit later. So you can see here, there is actually, from our initial kind of preliminary data, there is a really strong rationale for undertaking work in this area, as it can potentially be important in terms of thinking about inequalities in diet and diet-related ill health. So our project extends this preliminary analysis to answer these three kind of major questions, to investigate whether frequency of use of grocery services is associated with share of the purchases and total energy nutrients, to explore whether changes over time in the use of digital food delivery services is associated with these changes, and also to examine socioeconomic inequalities in environmental exposures to takeaway food delivery services, and whether this is associated with purchases over time as well. So just to very briefly say, our data is kind of very good quality data. It's from the Kantar Fast Moving Consumer Goods panel, and we have item level information on food purchasing based on data from a previous study, the TFL study that we did, which has around about 1,500 households in it. We also have some information from a survey about who uses digital takeaway food delivery services, and we've also scraped some data from websites to kind of work out at 12-month intervals what kinds of exposure households within our panel have, and these data sets will be linked to the household level. So how can you help? We've got a series of questions here, and I'll just kind of leave them up. I won't read through them, but maybe you guys can just read that quickly, given the amount of time we have, just to potentially put any answers in the chat, and I think I'll finish there. Thank you.
Thanks very much, Steve.
I noticed, sorry to say that, hang on, it's gone tunnel a bit. So maybe I'll read the questions out. So first of all, kind of is this area of interest, research of interest to only policymakers who are here today? Are these the kinds of questions that you need answering? And I think more importantly is we're kind of interested in working out what kinds of questions are best for policy in terms of affecting decision making. So anyone who has some ideas around this area who likes what kinds of evidence they need in practice at the moment would be very useful. And also how important is this work to kind of the post-pandemic policy environment? So we've talked a lot already about the potential window of opportunity for change. And so it'd be interesting to know how important the food environment is, I think the food retail environment is for kind of post-pandemic planning in terms of public health. And also if there's anything else we missed, then please feel free to kind of add that as well.
Great, thanks, Steve. We've got about 5 minutes. Ruth Kippings asked whether you expect the kind of 2020 pandemic changes online food sales to be sustained. I'm guessing you're going to say yes.
yeah, up to a point. I think there is a natural threshold at the moment to use, and I think I've been looking at some market research reports, and they suggested that there's the potential to grow up to around 46%, 45 to 46% of total grocery sales. So yeah, so not everyone's going to switch online, that's for sure, but there will be a substantial proportion of the population that does. I think the issue at the moment is it's generational, right? So kind of older people don't tend to use these services very much at the moment. But as the population, as that kind of the consumer base kind of ages out, as it were, and younger people who are more kind of digital natives come in, I think the potential is to do most of the shopping kind of online as a result of that. And just one thing I was going to say is that one of my PhD students, kind of Robert Greener, we've got him to kind of re-scrape some of the data this month, and he was saying, when I spoke to him yesterday, that the number of potential outlets available for people for delivery has tripled in the last 12 months. So it's gone from around about 12,000 stores within our sample to around 36,000 just in the space of 1 year. And that's probably to do with changes in regulation.
Can you just stop sharing your screen, Steve?
Oh, sorry. There we go.
That's better.
Yeah.
So Ruth's also asked, what do you think could be the policy response to the inequalities that you showed? The association between fast food delivery and social gradient and BMI, which I think is a really interesting question.
Yeah. So I think it's a difficult one. I think traditionally you would probably have thought about how you might kind of regulate the proliferation of those kinds of services as you would do for physical retail. So at the moment we do have planning policy and planning regulation that allows you to do that. I think it's much harder to do in the virtual environment, but I think it's something that needs some kind of thinking through. And that, you know, just to say you still need physical retail in order to deliver digitally. You need somewhere to prepare and cook food. Okay, so proliferation, anti-proliferation planning regulations could still work for the digital space as well if you do that. I think the area, I think, you know, Matt Keeble and your team, Martin, is doing some of this work. The grey area at the moment is that we are traditional physical retail like restaurants, McDonald's, and so on, they are already regulated to some extent. You can apply policy. It's the kind of the digital first brand, digital only brands like dark kitchens, for example, that don't have physical presence on the high street that need looking at.
I have one question then about the inequality, because in some ways it seems slightly counterintuitive, because there's a premium on home delivery. So you're paying more, and yet you show that the takeaways are ordered more or consumed more by the poorer. I just wondered how, what's your view on that? How do you account for that?
Well,
one thing that occurred to me is that there might be confounding there with the obesity.
Yes, that's possible. Yeah. Okay, I've got a theory. Okay, and so we don't have quite enough data, but if you look at the types of brands that people patronize, who are in kind of lower income groups, they tend to be at a certain price point. And so I think partly the use is driven by price point. So if you're spending less than £10 per meal, they tend to be consumed more by lower income households, so simply more affordable. So I think it's something to do with the type of offer within the digital environment. The second thing actually is that there is a delivery charge. Both the cost of delivery is borne by the supplier, by the retailer, not by the individual. I think Deliveroo has been in the news recently about really overcharging and kind of gouging basically retailers. I think Just Eat, which is by far the most popular platform, doesn't do that. So the premium for delivery is actually quite low in that channel, I think. Just to say that I once had a conversation with someone from Nando's about food delivery, and they basically said that they pitch all of their meals for a total cost of less than £10, because that's the segment of the market they want to attract. So more affluent people tend to spend more, and that's just simply they're not in the market for that kind of brand.
Yeah. So Carolyn's asked a question about, it's disappeared. There you go. Whether you're looking at nutritional content, including alcohol, of each outlet.
We're not looking at per outlet. I think that might be quite difficult to do, but we are looking at the nutrient content of what's purchased by households. I think Jean's doing some work trying to look at nutrient content by retailers. I think that is quite a difficult thing to do, and we actually don't have the data here for that. In our kind of attempts to scrape information, you only get partial information from menus anyway, though you do get a sense of popularity within the store and so on. But it's difficult, I think.
And then Catherine Schartz asked whether there's an assumption here that takeaway food is always HFSS, which I think is obviously an important point, and I guess is more applicable to Deliveroo than just.
Yes, that is true. So I think the advantage of the data that we have is we actually know what is bought. Okay, so if we know people are using takeaway delivery services, we can actually track it back to exactly the individual items purchased. And so part of the project is about trying to understand the nutrient content of exactly what is being bought, because we have that kind of level of granular level of information, so we can actually work out what types of food are being purchased online and whether they're healthy or unhealthy.
And then very last question, Ruth asked about whether you're working with the FSA in terms of food safety, but I guess that's probably not in your remit. I don't know.
No, we're not looking at environmental health, but obviously it's an important kind of element, and I think kind of regulation, particularly of these digital first brands, are kind of quite important going forward, I think.
Well, look, Steve, thanks very much. You've really whizzed through everything amazingly quickly in a very short space of time. I'm very conscious we're breaking into people's coffee break and anxious not to do that. But just want to say thanks to all of our speakers for a really interesting session. And I'm sorry that there have been some technical difficulties. I guess we are, even a year into the pandemic, still learning about how to do this sort of thing online. But thanks to the organisers also for troubleshooting and making these things work. And if people do have further questions for any of the speakers, please do contact them. You will be able to find their contact details either on the conference website or on the NIHR SPHR website, or just Google them. You know where they are. So thanks very much, everyone. Cheers.